Okay, great. Okay, thank you. All right, so hello, I'm sorry for the delay. This is Dr. Sara Siddiqui. I'm a pediatrician at the Huntington Medical Group, and we do our monthly talks here regarding any topics that you wish. So this month it's sibling relationships and toddler behavior, specifically sibling rivalry. And this is a very common question or occurrence that happens. Most likely it involves the parents asking questions after they've had their first child and the second child is on the way. So during pregnancy, we talk about it, or even afterwards when the children are, when you have multiple children, or you have, the children, multiple children in the family, and it is very, very common. So this is a great topic. Again, I have no disclosures to identify. I'm not affiliated or getting any compensation for this lecture, and the advice given here does not replace that of your primary care provider or medical practitioner. So of course, any specific medical advice, you want to consult with your doctor for any specific issues. But I'm so happy to be here, so welcome. Please, you can maybe, if you have any questions, I don't see the actual Facebook feed because I'm on Zoom, but if you have any questions or concerns, you can always put it in and I will try to get to them at the end, or you can always send in questions and I'll try to answer them as best as I can at a later time as well. So, this is a very common question. My children are having trouble getting along, so how can I help them? This is extremely, extremely common as caregivers. If you have multiple children or children that you're caring for, multiple ages, different age groups, even twins, so the same ages, it's very, very, very common and normal for children or siblings to fight over things, so toys or items, or and then especially fighting over attention. So that's going to be a major point also. And then it's also very common for them to argue with each other, tease, tell on each other, kind of have, different behaviors exhibit. And this is we're going to go through some tips. I mean, obviously, each child is different and the answers are going to be different, but some things that as parents we can do to help out. But this is very, very common. So what is sibling rivalry? It's when children do not get along, and usually it's based on the feeling that a child may have if they feel, so it's their perception that they feel that a parent or caregiver is preferring another child or sibling, or certain treatments that they get that they see other children getting that they don't get. So this kind of brings about feelings of that things aren't fair, or things aren't what they're supposed to be. And again, this is very normal and it will pass, but it is very common, and it leads to conflicts between the children and sometimes even between the parents and the children. And it can occur at any stage of development, but we are going to go through a little bit more on toddler behavior. I don't know if you caught my speech on my lecture or whatever on developmental milestones last month. I was really went into details about certain developmental things that happen at each age, but specifically the toddlers we're going to be talking about a little bit more. And so essentially each child is vying for parental attention, right? So there's, of course, when you have your first child, it's basically you and the parents or the guardians with the one child. So you're giving a lot of attention to that one child, and then as you have more, it's almost that you have to divide up your attention, but it's not going to be equal because each child's needs are different, and that's what you want to try to explain to the children as well. And then certain behaviors can stem from the competition of attention. So if one child feels that they're not getting attention, again, in comparison to the other child, and again, this is their perception, but and these things kind of tend to flourish sometimes. So each child has different needs, and of course, when you first have a newborn, they're going to have much, much different needs than your 2 or 3 year old does. And obviously, their needs have to be met to their requirements, right? So sometimes it's hard to explain that to a 1 or 2 year old that has a new sibling. And so it does take a little bit of time, and you know, and it does take a little bit of practice on how to manage if a child gets upset that they're not getting the attention that they need right at that moment. So you want to make sure that you understand that each child is different. They have different personalities, relationship style and needs. They have different strengths and different weaknesses. So you know, it's really important to remember that something that works for one child may not work in the same way as the other child. But they're all watching you. So they're all watching how you kind of interact with each child. And then, and, you know, that sometimes plays a role in how everything can be managed. And each child is unique in their own way. So, and again, when you're trying to kind of help to manage certain like sibling rivalries or certain arguments that children may be having, or certain personality traits that each child has, you don't ever really want to comment or compare between the siblings, or even people that are on the outside, like cousins or friends. You really don't, you want to really avoid comparing, you know, comparing behaviors of other children to your child. You know, if it's a positive, it might be helpful, but you really want to just kind of praise and give feedback to your own child as an individual. So we encourage that. You know, I encourage all parents to try and do that. It's easier said than done, of course, when you see a behavior of another child, and then you always kind of want to say, oh, well, look at so-and-so, and they, you know, happen to be eating this way and eating this item. But again, each child is different. Each child has their own likes and dislikes, and each child has their own preferences to things. And we really want to concentrate and make sure that your child feels that they are loved just the way they are. So that's really important. So when the siblings do tend to argue, if they're a little bit older and they're fighting over a toy, or they're fighting over time, or they're fighting over something, it's very important to kind of try to stay out of it, as long as they're, you know, being safe. But you definitely don't want to take sides. So if you do have to get involved, you want to kind of separate, change the subject, kind of change, you know, try to put them in their each designated spots, maybe, and maybe hold a family meeting, which we'll get to in a couple more slides. But these are all kind of things that you can use. Distraction really works, just to kind of, or, you know, removing the item of interest, you know, to kind of taking that out of the way. It's difficult. It's really difficult as a parent sometimes to navigate all this, but know that it is very, very common, and that it does pass, or it kind of goes into different, you know, different stages, but it does pass. If you need to, you know, if for some reason there was some argument, or was something where the safety was a concern, or what a certain issue was a concern, try to take that child aside and try to respect their privacy. You don't want to discuss or discipline or kind of you know, yell at your child in front of even your own other children. So you really want to maintain that respect and dignity for the children. So that's really important, because this is how they learn how to resolve conflicts as well. And so if they kind of did something wrong, or you felt that something was not handled properly, you want to take them aside, maybe in a private room, discuss when you're calm and they're calm at a later time, because you really don't want to say something that you may regret later in the heat of the moment, which can sometimes happen. And again, these are all just recommendations, and these are definitely easier said than done. But this is something to just think about as you're kind of going through these natural things that occur in families. You know, be fair and kind. Kindness is really important. I mean, obviously they're our children, and we want to make sure that all children, all our kids feel loved and feel, you know, included in every way. And it's easier said than done. There's always, sometimes when siblings argue or fight, obviously there may be a wrong and a right in there somewhere, but you really want to stay out of the argument or the specific reason that they're arguing. Learning to resolve their conflicts on their own really goes a long way. So if you kind of say, well, how do you think you would resolve this? Or what do you think you would like to do? Or what's the ideal thing that you want out of this? I know it's hard to discuss with younger children, but as they get older and they're kind of, arguing over maybe screen time or a computer item or an iPad or a show to watch, maybe try to see what things they can come up with to resolve the conflict. Maybe get some ideas from them and try to go from there. And look for the positives. So maybe there was another time when they resolved a conflict, and you found that way was really a good way that they both behaved, or they all three, or all the kids behaved. So you want to bring that up, and you want to kind of talk about it, and you want to say that why don't we model that situation, or why don't we watched a movie last time that was preference to one, maybe we can watch a different movie because it's the next time. But again, try to have them come up with the resolution instead of you coming up with the resolution. That helps your mind too, because honestly, it's very easy for parents to kind of get pulled in, and you want to try to stay out. You want to try to kind of just make sure the situation is safe, but otherwise stay out, because it'll just help you and it'll help them to learn how to resolve the situation. So a family meeting. I've done this with my kids on occasion. It's fun. I mean, it's not something to do when there's active issues going on. So you want to plan it. You want to plan on a day, that you have a little bit of time, or carve out maybe like half hour, a short time, depending on the ages of the children. Obviously, for the very young children, there's other things that we can do, but I'm talking about school-age children. You may want to organize like a family meeting where each person kind of comes up with ideas or things that they're concerned about, or their kind of, complaints and issues that they have. So everybody brings that to the table, and you kind of, make it short and sweet. So that's key. You really don't want to have a long, drawn-out family meeting, because, that can be quite tedious for the kids and the adults. So but you want to make sure that everybody has a voice, and everybody kind of clearly states if they do have certain issues. You want to make sure that you're fair, and that you, again, maintain privacy for each child's issues. And maybe this would be a good time to kind of carve out some expectations, if you haven't already, or some kind of like what certain issues are that you've seen, and you can bring that out. But again, you're kind of playing like a mediator. You're trying to just hear out what everybody else is saying, and you're giving a platform for the kids to kind of empower themselves and see if they can kind of, resolve how they're feeling towards each other themselves. And ideally, you want everybody to get along at all times, but again, it's difficult depending on the ages and how they're developing and how they're feeling. And during these times that we're all at home, or some days we're doing online learning, so we are home a little bit more, there's a lot of stress and a lot of tension that children may be holding. And sometimes the only way they kind of vent or let it out is by arguing with their siblings. So reach out to your pediatrician or your medical provider, because there are some things that we can do, or we can guide you. There's some resources that we can give to you that may help if the situation requires that, or if there's another reason that perhaps there's some issues going on with the kids. So again, sometimes there's a lot of some ways to know that your child may be going through some stress is that they kind of they're acting out of the normal. So all of a sudden they're arguing about little things. They're arguing about their place at the table, or when they have to go to bed, or when they have to wake up in the morning. And sometimes it makes a little bit easier for the siblings to be arguing, because their kind of thresholds for tolerating each other can be lessened right now. And so it is something to think about. What we're seeing in the younger children as far as stress and behavioral issues is that they have a lack of appetite, they don't sleep properly, and they become a little bit more irritable and cranky. And this can lead to fighting with either the younger or the older sibling. So it's important to kind of keep that in mind, and keep that in mind when you're talking about the conflict resolution, and just talking about why perhaps they're acting out, and it may be giving you a better understanding also, so that it helps you to kind of deal with it too. And you do want to reach out to your pediatrician. Another reason I just wanted to mention too is that when they're tired or hungry, this could also lead to decreased thresholds for tolerating certain things, and that could also kind of make for conflict within siblings or family members. So and then I will be giving you some resources at the end. So so this is a big topic that usually comes up. So as I said, the parent already has a child, and usually between the ages of well, it's a broad range, but in the toddler time is when perhaps a new child is on the way, a new baby's on the way. And so we have to remember a couple of things. So one of the first things I start telling the parents is that, your first child has 100% of your attention. So all of what's going on now, you're focused on your child, right? You're seeing their every moment, which is great, because you have the one and you're kind of focused on them. But as soon as you bring that newborn home, even if you're giving 90% of your attention to your older child, they still feel that. So they still feel that little bit of the attention kind of changed or shifting. I mean, and so we do encourage parents to attend a sibling class. Now I think Huntington Hospital has them on Zoom. But before the pandemic, Huntington Hospital and many different hospitals would offer sibling classes. And basically they would go through books, they would kind of have dolls, and kind of just modeling, there's a new baby, we have to be soft and gentle and nice with the new baby, and kind of explaining that, you're going to be a big brother or big sister. Of course, depending on the age, I mean, if they're around 2, they're kind of not completely understanding. A lot of times, one of the things that I can remember from my practice is that, a 2-year-old came in with the sibling, with the new baby, and, the mom told me that they asked mom when the baby's going back to the hospital. Like, when are you returning the baby? Because I want to go back to how things were, right? Because you got to think about it. It's like a big change for them, right? They were kind of, anytime they would just kind of even ask for mom or dad, you would come running. And now things are a little different. The baby has needs too. So just like with older children, each child has different needs. So a baby, a newborn baby and a toddler have completely different needs. But I do tell parents, so let's say that your toddler or, the oldest child, or even the middle child, and then you have a third sibling coming. If they're both upset, if the infant or baby is upset in a safe place but crying, and the toddler's upset, you may want to just go to the toddler and make sure that everything's okay, and then kind of take him or her together to the baby and say, okay, let's see what's happening to the baby, so that kind of helps to guide them and kind of allows them that little bit of understanding. And they do wind up getting it, of course. They do understand that they have to be gentle and things like that. And then sometimes there are certain regressions that take place. And the regressions are honestly, again, they're vying for attention. So another important thing that I try to tell parents is to try to give a lot of positive attention. So sometimes if you're always kind of saying, you know, only noticing the toddler, only noticing the child when they do something that's not so good that they shouldn't be doing, that reinforces them to continue that behavior because that behavior got them attention, right? So let's say if they're sitting quietly, doing nothing, and behaving quite properly, you're kind of, you don't mean to, but you're kind of ignoring them, right? Because they're just kind of sitting down and coloring and doing what they're supposed to be doing, and you can have time with the baby. But that's the time where you want to say, oh, you know, that's the time that you want to notice them and you want to give them some really, really positive feedback because you're accentuating that positive behavior that you want to see. When they begin to act out and they begin to kind of, you know, now they're getting fussy and upset because you're not noticing them. And then finally you kind of say something like, oh, don't do that. Don't climb on the couch or don't jump up and down like that, or the baby's sleeping. Then they take that as attention. And you're kind of reinforcing the behavior in their mind. So, you know, it's easier said than done. It's very difficult to try to remember this in the heat of the moment, but it is really important. And this is general, like toddler behavior too, that you really just want to accentuate or really give positive feedback to the behaviors that you like. Right, and the older child, I'm just reading, making sure I got everything on this slide. So the older child had 100%, you're giving even 90% it's left. So, but give it time. As time goes, it does get a little bit better. But the other thing that starts happening is as the baby grows and their needs change, the whole dynamic changes again. So as the baby starts rolling over and you're kind of noticing that, sometimes if you don't notice something that your older child did, it does cause like a little bit of where, you know, they feel that they did the same thing but not get recognition for what they did. Like if your younger one starts to walk and your older one has already been running, and they're seeing that, you know, you're kind of giving a lot of attention to the younger one that's just starting to walk, which is great. But they notice that, oh, when I walk, I don't get any, you know, I don't get any accolades. So in their minds, it's different, right? So that's why they kind of start acting out or trying to vie for your attention again. So this is really important. So sometimes I'll say that when you bring the new baby home or you're bringing, you know, try to spend some quality time with the other children, because, you know, baby is going to take up a little bit of time, but they still want and enjoy one-on-one time. And this is really important, even as the kids get older. If you can do this, have like a one-on-one time, or mommy and me day, or a daddy and me day, you know, with each child separately, but fairly, you know, so you want to spend the same amount of time. And, you know, obviously you don't have to do the same things because each child is different. But now that we're kind of all, you know, at home sometimes, and we have a little bit more maybe time with the kids, you know, maybe there's not so much sports going on, not so much, you know, play dates going on and things like that. Maybe it's a good time to spend some individualized time with each child. And believe me, it can get very difficult. There's a lot of things on our minds too. But the kids really do enjoy talking once you kind of get them to talk, once you remove, if they're on a device or something like that, once you kind of remove that and remove your own device, it's really important to give some time to the kids and individualized time where it's just you and just them. So, you know, maybe even like a quick bite to eat or something like that, some time in the car, going to a place, you know, when it gets a little bit safer out, going out, but just one-on-one. And anytime there's a stressful situation or a child feels stressed, and, you know, this can happen at any age, and it can occur for many different reasons, but sometimes during sibling rivalry as well, there can be some regressive behaviors or some changes in behavior. So that can be very common, and it's important to recognize that this can be a normal reaction to any change in the household. So a common example of a regressive type behavior in a toddler, especially when the newborn comes home, sometimes if they were completely potty trained or trained, and then sometimes they see that you're changing the diaper in the baby, they might want the diaper back, or they might want their bottle back. So what can be done in these situations? You want to explain that, you know, they're older and they are the big sister and big brother now, and they get to do other things that the baby can't do. So you want to accentuate what they can do, right? They can sit in a chair, and they don't have to be in the crib anymore. They're in their bed. So those kind of things you want to really accentuate. Also sticker charts. So sticker charts I'm a big fan of to help with just behavior modification and to encourage positive behaviors, because you can do even for siblings that, you know, maybe fighting, maybe do a sticker chart for each of them, and or maybe a one sticker chart for both of them or three of them. And if they all get like 5 stickers, they all get something, because you want them to kind of build up that teamwork that they're doing together. So you want to, you know, build up that kind of unity or working together kind of concept with all of them. So back to toddlers, they're literally my favorite age group because I feel like they're extremely not understood. So I've always had a problem with the saying terrible twos. I don't like that saying because they're not terrible. They're so, I mean, their brain is developing so rapidly right now. I like to say individual twos are inquisitive, self-sufficient, independent, strong-willed, curious, investigative. I mean, they just want to, even when they come into the office with their cute little masks on, even though they're only 2 or 3, and they're great with their masks, by the way. They want to touch the whole entire office, and the parents are always like, don't touch that, don't touch that, don't touch that. And like, and it's so interesting because that's what they want to do, because they haven't been there in a while, and they want to investigate and they want to look at things, and that's normal. And it's really important for parents to know what's normal so that they can be realistic in their expectations, right? So you're not going to be able to, well, in the time of pre-COVID anyway, I would always tell my patients this, that you can't go to, you know, with your 2.5 or 3-year-old, you can't really sit in a restaurant for longer than like 20 minutes and expect them to be able to sit for a long period of time, because that's just not, you know, who they are. They're not built like that. I mean, maybe they can get like a half hour, but after that, you're going to be chasing them around the restaurant. And anybody that would say something to you either doesn't have kids themselves or hasn't been through that, because we've all been through where we either go to a restaurant and the child is acting up, or we go to a restaurant and someone else's child is acting up. And I'm always, you know, now I miss those times because my kids are a little bit older, but it always, you know, I always try to tell parents that that's realistic, that's an expectation, that's a normal toddler behavior, that's a normal behavior. And how do we, you know, how do we modify those behaviors, or how do we encourage, like, you know, certain expectations? You try to model the behavior yourself. You try to have realistic expectations. So again, don't set yourself up for failure. If they're hungry or tired, and you're going out with 2 children, you know, 2 or 3 children, you're going to Target or something, you don't want to go right before lunchtime, right before they're hungry, or right before they're going to be taking a nap. That's not a good time to go, because things are just, they're going to be at that lower threshold that things are going to bother them more that may not bother them otherwise. So just think of yourself too. Like, if you're tired and hungry, you're not going to tolerate the grocery store as well as if you're, you know, kind of in your nice post-workout stage, right after a good workout or something like that. So, and then model the behavior and really, you know, pick your battles. So, all right. And then why is it important for parents to understand normal child development? So like, you know, my previous talk, this also helps us to understand what to expect from our children, right? So especially when they're fighting with each other or having certain issues with each other, it's really important that we know what stage they're at and how to best navigate, how to handle, you know, how to handle it. So, and then really when things are, you know, difficult, or there's always some fighting going on with the siblings, or, you know, you're always trying to, you know, resolve conflicts. It's difficult. It can be difficult, but you can try to, you know, make sure you're taking breaks, make sure that you are trying to, you know, develop the best resolution possible. Make sure you try, depending on how old they are, you want to distract them. Sticker charts or reward kind of behaviors are very important. And conflict resolution is really like an important skill that comes in handy throughout life. So it's very important for children to kind of, you know, get get a little bit used to resolving their conflicts on their own. So that's another, you want to kind of separate yourself from the conflict. And, if all else fails, try to remain positive, and then seek help. There's always that we can give you some resources. Sometimes family counseling or some counseling may help. You want to accentuate what is working. Again, the family meeting may be something that that we could recommend or do. And there are certain situations that you need to kind of involve your doctor, your medical provider with, and to make sure that everything is okay. I love this website. I know I mention it. I think I mention it all the time. The healthychildren.org website. It's a great website on all things children. It's by the American Academy of Pediatrics, and some great tips and information on all sorts of things, but sibling rivalry is a topic on there too. And then this is some of the websites that I got some of my information on. So we're kind of headed towards like the finish. Yeah, so if you have any comments or anything, questions, I'd be happy to answer. If not, I think this is going to be recorded and you'll be able to watch this at any time. I really enjoy doing these talks. I look forward to doing it in person again. I used to come to the library and do some in-person talking too. So I look forward to maybe doing that at some time in the future once we kind of get this whole pandemic resolved. I'm thinking that we might be towards the end of it because the vaccine is coming. But again, I truly enjoy it. If you have any topics that you want me to cover, I know the topics are decided quite in advance. So when we were thinking about the topics, I just felt like this is a good, important topic to kind of cover. So there's so many different things on the news right now. So sometimes it's a good idea to just turn off the news and kind of focus on your family and your friends and try to take time for yourself too. But I hope what I said helped, and I hope that everybody's staying safe and healthy and happy. And please reach out anytime if you need anything.